So welcome everyone to today's session, which is all about the situational judgment section of the UCAT. So this is our last, workshop in the UCAT series, but arguably one of the most important ones because situational judgment is a bit of a tricky session, and we're going to take you through a bunch of tips to make sure that you perform better in this section. So a little bit more about us. We're the Aspiring Medics, which is a social enterprise, and essentially it just comprises of medical students from across the country. So we give you personalized tips and tricks that work for us, and we also offer affordable services. A lot of them are free, such as our UCAT guide, our application guide, these workshops, and some of them are very, very affordable, like our personal statement review service. So I'm Arisma and I'm a medical student at King's College London, and I did my UCAT back in 2019.
Hi, my name's Yusuf, and I'm a medical student at Oxford University.
So these are just some of the benefits of joining our workshops, which we will be taking a break from next week. So once situational judgment gets over, we will be taking a break and we will be sending out the next schedule. We will be uploading it on our website for the next 5 sessions, and we will also be sending it out in our weekly newsletters. So if you haven't signed up for those, definitely do that because we send weekly updates on important medical information as well as some of our services. So here are the objectives for today's session. We're first going to learn more about the situational judgment section, then going to look at its purpose. We're then going to look at tips. And lastly, we're going to practice some questions. So our first question is, how confident are you right now in the situational judgment section? Okay, so again, there's a huge variety in this response. We have a 1 and then we have a 4, which is completely fair. Situational judgment is slightly tricky, especially with the answer choices, because sometimes they're way too similar to each other, which makes the entire section pretty tricky. So we're at an average of 2.5, but hopefully through the session, that average will get better. But more importantly, what do you guys find most challenging about the situational judgment section? So I know we've spoken about time pressure a lot in the past. Is it that? Is it the answer choices? Is it even the fact that it's the last section of the exam? So inevitably, you're going to be really tired and exhausted by the end of the 2 hours. The gray areas of decision making, yeah, second guessing yourself, definitely. Especially when you complete the entire set and then go back and you're like, wait a second, was my first answer wrong? That's completely fair.
Absolutely, we can certainly go through this, and this is a very common thing in terms of second guessing yourself. And again, through experimentation, you'll be able to find out what the most effective strategy is going to be for you. And of course, you'll get more confident in doing so through practice.
So let's look at what the situational judgment section is even about. So you get 69 questions in 29 minutes, which means you get around 25 seconds per question. This does seem like a very poorly timed section, but the scenarios themselves are pretty short, easy to read, and the answer choices are fixed, so you don't waste a lot of time reading the scenario or reading the answer choices. So it's actually one of the well-timed sections of the UCAT, and each scenario may have up to 6 questions associated with it. Now, something that I didn't mention in the slide is that this is the only section to be scored differently than the other sections of the UCAT. So you aren't scored numerically up to 900. Instead, you're scored in bands, band 1 through 4, band 1 being the best. And an important thing to note is that usually medical schools, do not even look at band 4. And if you get a band 4, your application is immediately rejected. Band 3 is all right, but it's not the most ideal. But band 1 and band 2, that's where you should be aiming because medical schools love that and they don't really discriminate between the two. Even if you get a band 2, it's fine. So really focus that should be your aim. And then this section aims to test your ability to make ethical decisions, which are in line with the code of conduct expected of all professionals working within the NHS. You will also need to demonstrate understanding of values such as confidentiality, patient safety, honesty, impartiality, and equity, amongst others, and how these situations will be applied to real life situations. So, not just medical situations like you're in a hospital, you've seen a consultant drinking, not just situations like those, but also in real life. For example, you've noticed your friend is cheating on an exam in school. You will have to apply these very same principles of honesty, impartiality, equity to that non medical scenario as well. So there are three types of questions. Number one is where you rate the importance of a series of statements in response to the scenario. So very important, important, mildly important, or not important at all. And then type two is where you rate the appropriateness of a series of statements as applied to the scenario. So appropriateness, and that is very appropriate, appropriate but not ideal, um, completely inappropriate, and I think inappropriate but not awful. And then type three is where you rank these statements in order of importance. So similar to decision making, where you drag the yes and no, you will be dragging these statements in their order of importance. So that's it about the situational judgment section and what it's all about. And now let's look at the purpose of this section. So again, if we could just go to Slido, and why do you guys think this section is important? I mean, it's pretty self-explanatory even with the name. So if you have any ideas, put it down. So to demonstrate that your values are aligned with NHS values, definitely.
That's absolutely perfect. Exactly that. Everything that's done throughout the medical school application process is to ensure that they're selecting candidates that are going to be aligned. It's called values-based recruitment. It's particularly important because they want to see that you can work within the NHS, for the NHS, and actually continue to work within the NHS throughout your lifetime as well. So this is a really important thing. So really well done, guys.
And as we've said before, all parts of the medical application are intertwined with each other. And I think of the UCAT as a sort of cheat sheet to figure out what medical schools are looking for and what the NHS is looking for and their future potential doctors. So look at the five sections of the UCAT and what value, what skill are they testing in each of those sections, and make sure you elaborate on those skills in your personal statement as well as in your interview. So demonstrate that your values are aligned with NHS values. Definitely put in examples in your personal statement of how you are aligned with the NHS values, because all of these particular skills that they're testing in the UCAT, they also want to test in through your personal statement as well as through your interviews. So use the UCAT as a sort of cheat sheet. Someone else has also said test your ability to understand real life situations and react appropriately to them. Again, very good, perfect answers. So if we just look at what we put down, as a medical student and future doctor, you have a moral duty and are expected to behave in line with professional requirements. Another important thing is that final year medical students actually have to pass this test called the situational judgment test. And the UCAT situational judgment test is kind of like the baby version of it. But in your final year of medical school, you kind of do the exact same test. And that's when you become a foundation year doctor. And so you can just see how it's really important. Situational judgment and testing NHS values is really, really important to the NHS and to medical schools.
Absolutely. So 2 points to pick up there. One, the fact that this is a common recurrent theme, right? They're not only testing this during the medicine application process at year 13/year 12, they're also testing it right at the end of medical school. So you can see how important this is, okay? The other thing to note within that, one, it's a blessing in disguise in the sense that it's good practice for something you have to do later on anyways. But secondly, make sure you do your research carefully. So when you search situational judgment questions, make sure you look at the UCAT ones and you're not looking at questions for FY1, the bigger step one, okay? So that's just something to note when you're doing your research and looking for SJT questions. Make sure you're looking at the UCAT version.
Yeah, I think those are some very useful tips because I know of people who have been confused by the two before. So then just moving on to some of the skills that you need in order to be professional. So you must adhere to values of confidentiality. You must have respect for the patient's condition, expectations, and beliefs. You must also wear appropriate clothing and be well groomed. And this helps inspire confidence in patients. There are actual studies conducted on this about how patients trust doctors in more formal clothes rather than casual clothes. And there are actual statistics on this, which I think is very interesting. And you must also be prepared to step in if help is needed. And I think most importantly, you should also be able to ask for help when you really need it. You need to be honest about your mistakes. You need to adhere to infection control guideline, and the list just continues. But these are just some of the things that you really need to keep in mind and things that the situational judgment test tests as well.
Absolutely. And all of that is going to be important in order to prevent patient mistakes. And on a much greater scale, on a macroscopic scale, when you hear about, say, NHS scandals that have happened, when you're looking at negligence, for example, it all underlyingly comes back to decisions that were made and not being able to have those checks being made. So this is so, so important. We can't stress that enough.
So that's about it for the purpose as well. And now let's look into tips. So we've really gone into details of tips for today's session. So it will take longer than usual. It's not just the one slide with our 8 tips, but it's really thorough. So this really should probably help you guys in your test. So as I've said before, number one is read good medical practice and go through NHS values. And another thing is to go through the medical school council values. So this is what medical schools are looking for in their applicants, right? And you can go to the link, or if you go to our personal statement guide, there is a section called MSc values. And if you go there, that's just 4 different graphics of all of the values that they're looking for. So good medical practice, NHS values, MSc values in our personal statement guide. That's number one, because essentially what the NHS wants is that you follow the guidelines that they've set out for you. And this is a document with all of the guidelines. And if you follow the guidelines, you will be ethical in their eyes. And that's what this section is testing you on, like whether you're ethical in terms of NHS values or not. And number two is to put yourself in the shoes of the main character. So what does this mean? That in each situation, you can either be a dental student, a medical student, a junior doctor, a consultant, a patient, maybe just someone standing in a hospital, not even from the medical field. And so it's really important to put yourself in the shoes of that particular character, whoever the situation is about, and accordingly answer questions, because for sure, in terms of a medical student versus a consultant, things will be of different importance and things will be of different appropriateness. So it's important to remind yourself who the situation is even about. Number three is to, again, read the question carefully and read what are they really asking you to do? What are they asking you to rank? That's really important. Number four is judge each question within the set individually. So just because question one in the set, the answer was very appropriate, that does not mean that future questions can't also have the same answer. All 4 of the questions in the same set can be very appropriate. So don't let a previous question dictate the answer of a future question, and just judge them individually, even though they have the exact same scenario. Again, as we've always said, flag, don't panic, and move on. This is also the last section. So it's really important that you also practice your, just focusing. And another tip that I haven't mentioned here, kind of derailing from the topic, but in the UCAT exam, before every section starts, you get a 1-minute timer to read the instructions on the screen. And now by the time you give your UCAT exam, you would have practiced enough to already know what those instructions on the screen are. And instead, what I used that 1 minute for was just to relax, close my eyes, just rest my eyes, rest my brain, and get prepared for the next section, which I think is so important, because sitting in one spot for 2 hours is crazy and it's so hard to concentrate. So definitely use those tips as well. And this is the last section, so you will definitely have that urge to just click on whatever and just skip and move on. But make sure you come back to everything, answer all the questions. Even if you don't know the answer, just guess, and finish this last section properly. Don't just let it be, and actually put your focus into it. Just push through this last section as well. The next one is know the difference between the answer choices. This is something that I personally struggled with as well. So what's the difference between important and not that important, or appropriate but not ideal, and inappropriate but not awful? So those answer choices are pretty close in what they mean, and it's really hard, especially with those middle 2 answer choices, to figure out which one is the correct one, because of course, when a situation is very appropriate or very inappropriate, that's pretty easy to identify. It's the middle one, the gray area, that's a bit hard to identify. But in the next few slides, we're going through what each of the answer choices mean. So hopefully that should help you guys. Another thing is to read the explanations while practicing. So the UCAT itself has practice questions. When you go through them, they give an explanation of why the answer that you chose was correct or not. Read all of these explanations, because it's just like reading good medical practice or going through NHS values. It's the exact same. Their explanations will also give you an idea of what good medical practice is and what values they're looking for. And lastly, as usual, practice, practice, practice. very, very important. The more you practice, the more you expose yourself to these different situations, and the more adept you become at making these decisions correctly, and making them fast. So here are the answer choices. One is very important, which is absolutely essential to consider. Think of it this way: if you do not consider this, then everything will go wrong. So you have to consider this factor. Number two is important. So it isn't essential, but it is useful to consider this factor or this aspect. Of minor significance is that it's kind of irrelevant, but there are no harms associated with it. So you can still consider it without harming the patient or harming patient safety, but there's no real need to consider it. But because it's not harmful, we can call it of minor significance. And then lastly, not important at all, absolutely irrelevant, might even harm the patient or might harm patient safety. Next is the flip side of this, so very appropriate to very inappropriate. So very appropriate, this is the most optimal, the most ideal approach. The second one is appropriate but not ideal. So this is a good approach, but it has a few flaws, so it's not the best one. Inappropriate but not awful. This is not a good approach. However, it only has a few cons, so we can still live with it. And very inappropriate is an absolutely horrible situation and will definitely make patient safety worse. It will endanger the patient. It will make the entire situation worse. Now, the difference between appropriate but not ideal and inappropriate but not awful is that appropriate but not ideal, you don't have any cons in that situation. It's just that there are fewer pros than the most appropriate situation. However, in inappropriate but not awful, you do have a few cons. You do have a few disadvantages of choosing this option, but there aren't that many for you to call it very inappropriate. So I hope that's made some sense. And if you have any questions about this, about the answer choices right now, feel free to put them in the chat or put them at the end in the audience Q&A, and we'll definitely get to it, because I understand that this part is slightly confusing. So our next question is, what are some NHS values to keep in mind while answering situational judgment questions? We've gone through a lot of them in the presentation already, and I've allowed you guys to input multiple answers. So what are some of the values that you need to keep in mind while answering these questions? This idea of everybody counts. Someone's also written patient safety in the chat. All correct answers. Confidentiality, respect, respect both for patients as well as your colleagues. The golden rule. Does someone want to elaborate on what the golden rule is? Someone's also written honesty.
I think the golden rule is like the spiritual teaching of treat everyone how you wish to be treated. An important value, not an NHS one, but absolutely the same things that are important for sure.
We also have compassion, again, very important. Any other ideas? So I've just added the words from the chat to the Slido as well. And I think this is a pretty good word cloud of some of the most important values that we need to keep in mind while answering situational judgment questions. So confidentiality, honesty, respect, compassion, patient safety, the golden rule, everybody counts. Another really important value is accepting your mistakes and addressing them, acknowledging them, and then apologizing. That is really, really important. And a lot of situational judgment questions are related to you making a mistake and then what do you do? So an easy way to remember this is the 7 C's. So you have care, compassion, competence, consistency, courage, commitment, and communication. So those are lots of words, but let's go through them one by one. So when we think of care, this is essentially the care that you give to your patients, and this must be of high quality. It must be effective, but most importantly, the patient must want that care. So a huge dilemma and a huge ethical dilemma in medicine is, I want to help the patient as a doctor, but the patient doesn't want my help. So what do I do? The simple answer is that if the patient doesn't want something, you don't give it to them, because patients have their own autonomy. So that's very important in terms of care. Then compassion, that the care should be delivered with compassion, and you need to care about the patient and the patient's condition. Competence. Competence essentially with regards to how professionals should know what they should do and what they should not do, and what they can do and what they cannot do, and should act accordingly. Consistency in the sense of being consistent in terms of the high standards of care that you should be delivering as a doctor. And also patients should be able to expect consistent and good quality care from you. Courage, so this is in terms of speaking up if you have any concerns, even if a senior member of staff has committed a mistake, you need to have the courage to speak up about it. And you also need to have the courage to accept your mistakes and acknowledge them. Commitment, providing the best care possible for every single patient, every single time. And lastly, communication. So being honest, number one, with your communication, but number two, also being clear and concise with your communication and being able to explain things to patients in words and language that they will understand as non-medical professionals. So those are the 7 C's, and that's just an easy way to remember some of the most important values that the NHS looks out for and some of the most important values that you need to remember while answering situational judgment questions.
Absolutely. So all of those values are going to result in increased patient trust and ultimately lead to increased patient outcomes. And it's all about doing whatever's in the best interest for the patient.
And now, lastly, the last content with regards to situational judgment that we're going to cover are the 4 pillars of medical ethics. So, if someone could tell me what the 4 pillars are, and then we'll go into more details of each of them. And we'll then move into the practice questions.
Fantastic. There we go. So someone has been looking at our website on our medical ethics and our acronym as well. It's the exact same acronym we use: BANJ, BANJ, beneficence, autonomy, non-maleficence, justice. And we'll be able to go into detail about this now.
So while these 4 pillars of medical ethics are incredibly important in situational judgment, they are also incredibly important for your interviews, which are going to happen by the end of this year or January of next year. So this is sort of a little taster into some of the interview content that you need to go over. And we're just going to quickly go over each of these pillars. So number one is autonomy. And this means that the patient has the right to make decisions for themselves. And this is free from direct or indirect duress and should be supported in doing so. So on our website, we have articles on each of these pillars. And for autonomy, I would really recommend reading Jehovah's Witness. We have an article on that. That is very, very useful. And we go over how autonomy works for different age groups. So is this an adult? Is this a child? Is it an adult with competence? So are they, in their senses that they can make their decision? Are they not? There's so many things that go into autonomy. So I really would recommend reading the Jehovah's Witness article for autonomy. We then have benevolence. So that is doing good by the patient, maximizing their health and their happiness. So again, a recent trend or a recent, I wouldn't call it a trend, a recent practice that has become very popular in medicine is patient-centered care. And essentially that means that we're putting the patient and the patient's needs at the center of everything that we do. So we change our policies, we change our practices to ensure that patient outcomes, as Yusuf said, patient outcomes will become better, their happiness, their health, we need to maximize that. So that's what benevolence focuses on as well. We then have non-maleficence, so not doing harm, never initiating a procedure or treatment with the intention of harming the patient, never causing harm. Now, this is essentially what you need to do, what you need to know for the situational judgment test. But definitely for interviews, you're going to be going into more details for each of these pillars. And something interesting with non-maleficence is, when we give out medications to patients, obviously they have side effects, and that we intentionally are giving medication such as chemotherapy to patients, knowing that it has harmful side effects. So we are consciously doing harm. But then obviously there's that risk, that benefit to risk ratio, and you have to look into all of that. And that's just something interesting to explore after your UCAT gets over, once you move into interview season.
Agreed. One thing that I'd like to particularly note with regards to autonomy is this idea of empowering the patient and patient choice. So a very important NHS long-term plan commitment is with regards to supported self-management. And that means empowering people to be able to manage their own ongoing physical and mental health conditions themselves. And that's particularly important, one, from an autonomy perspective, because guess what? If somebody chooses to do something, they're much more likely to follow through with it. And secondly, from a very cynical economic perspective, it's the cheapest thing to do, to be able to have people themselves being able to manage their own health. And of course, that's also linking into preventative health as opposed to just pharmaceutical and pharmacological approaches as well. So these principles are so key, and we're going to be able to build upon them in following videos as well.
And then our last pillar is justice. So every decision for every treatment must be undertaken in the fairest way possible. So equal treatment for equal need, despite the background of the patient, so you're not discriminating against anyone. But justice also has this aspect of working towards the greater good. So every decision that we make should be for the greater good of the entire public and society as well. So, for example, that means if you have one patient who you know would cause significant harm if they were to get out of hospital, and even though they are expressing, their will to leave hospital, you would not do that in the, in while keeping in mind society, while keeping society in mind and the greater good of society in mind. You would not discharge that patient because they are not ready to be out and free in society yet. So that's just a very small example of how justice is also important and how we
Uh,
really need to consider the greater good as well.
Absolutely. And there are 2 points that I wanted to mention with justice. One, in terms of the fact that the only way that we discriminate, and yes, we do discriminate between patients, and that's called triaging, for example, and that can happen at A&E when you're prioritizing patients. The only way that we prioritize patients is based upon clinical need. That's the only way we do it, not on their background. It's on their clinical need. Secondly, you might think, well, doctors aren't really doing anything illegal, but especially with regards to the cutting edge of medicine, whether it be, say, in vitro fertilization, most recently with cloning, with regards to the Lulu Nana case, if you're going to be doing genetic editing, for example. All of these are, of course, incredibly important to consider.
So that brings us to the end of the content that we wanted to cover. So we've covered medical ethics, we've covered the 7 Cs, and we've also covered the difference between the answer choices in the situational judgment questions. So now that you're equipped with all of this knowledge, we can now move into our practice session and look at some actual situational judgment questions. There aren't too many, I think there's 6, and then we can move into the audience Q&A. So Slido has now started quizzes. So there's going to be an automatic timer. Hopefully it should work just fine. But in the first question, I have given you 60 seconds. So you have around 30 seconds to read the scenario and then the next 30 to answer the question. And then in all of the subsequent questions of the same set, you just have 30 seconds to answer the question because you've read the scenario already. So without further ado, let's start. I think they might ask you to put your name, but you can just put something anonymous or just leave it as it is. So here is your scenario, and your 60 seconds have already started. I'm going to leave you to it and not disturb anyone. Just keep in mind that these are importance questions, not the appropriate questions. Importance. Okay, so that's the end of the timer. I think that worked pretty well. And 3 of you have put in very important, which is the correct answer. So for anyone watching the recording, and as we've mentioned before, a very useful tip in situational judgment is to read the explanation that the UCAT gives you. So I'm going to quickly read out the explanation for this question. So if the clinical guidelines state that an identification badge must be worn for patient contact, then this is clearly of great importance. Clinical guidelines are in place to protect the patients and public and ensure a standardized approach to effective and safe patient care. This consideration is therefore very important. So again, you can see the theme of them giving a lot of priority to clinical guidelines, and which is why we really recommend reading Good Medical Practice, because that is a set of clinical guidelines which will help you throughout this test. So in the next question, you just have 30 seconds to answer. Again, it is an importance question. It has the same scenario. So this is the next question, same scenario, 30 seconds. So 3 of you have said very important, which again is the correct answer. So this is just an example of how there were just 2 questions in this scenario, and both of them have the exact same answer, and that's all right, which is why it's really important to judge these questions individually. And reading the explanation, it is very important to ensure that patients understand who this medical student is and that she is still a training grade dentist. Without this information, they may think that they are being treated by a fully qualified member of staff. This consideration is, again, therefore very important. Now, moving on to the next situation, which looks at appropriateness. So here is the situation. So let's just go through this question. So this was, ask the patients in the waiting room if they've seen the boy's mother. And 2 of you said that this is a very appropriate thing to do, but that is not the correct answer. So the correct answer here is appropriate, but not ideal. And this is because the most appropriate thing to do, the first thing and the most appropriate thing to do would be to comfort the boy because he would be really distressed. And right after that, it is important again to ask the patients in the waiting room if they've seen the boy's mother. Another thing is that you would probably be disturbing the patients, which is also not completely ideal. Let me just read the explanation. Whilst asking the patients in the waiting room if they have seen the boy's mother would be a useful way of finding out where she has gone, it would be more appropriate to first comfort and reassure the upset boy. So that would be the most appropriate and a very appropriate thing to do in this situation. Distract the boys with toys and escort him to the play area. So this is the 60-second question. You will have enough time to read the scenario and then answer the question. So we have a mix of answers: appropriate but not ideal and inappropriate but not awful. I understand the confusion between those two. But the correct answer is actually a very inappropriate thing to do. Now, if I was in your situation, I would probably pick inappropriate but not awful. But let me read out the explanation and then we'll explore why the correct answer is a very inappropriate thing to do. So, whilst distracting the boy may take his mind off losing his mother, this doesn't attempt to resolve the situation. Further, leaving to deal with the sprained ankle means that Daniela is unable to monitor the boy's situation and try and find his mother. This is a very inappropriate course of action. So, what they want you to do is in every situation, you must solve something. And what this option, what they're telling you to do, so distracting the boy, then returning to the sprained ankle, you're not actually solving anything. You're just distracting the boy, which is a very surface level solution to this problem. And you're not actually, going to the root of the problem, which is finding his mother. So you either find his mother, do that correctly, or you tend to the patient with a sprained ankle, you fully focus on that. You don't juggle both of these things together. That's at least my understanding of it. They really want you to focus on one problem and not just do a surface level solution of something.
Exactly, into prioritizing the problem, two, prioritizing what would be the most effective solution. And one could argue that actually escorting him to the play area might be exacerbating the situation because if he's already lost and if his mother left him in one place, we don't know where they could be. And of course, we're only told about the mother. What about if he came with a father or a family member, for example? Or announcing it onto, for example, the office or A&E area to better notify and be aware of that situation, for example.
So moving on to the next question, 30 seconds. So all of you have said appropriate but not ideal. The correct answer is inappropriate but not awful. So let's look at their explanation. So asking the receptionist means that Daniela can continue with her work. However, this isn't the receptionist's responsibility, and it will mean that in turn, the receptionist is unable to pay full attention to her duties. Whilst not awful, this isn't an appropriate course of action. So it is what makes it inappropriate but not awful is that although Daniela can do whatever she wants, and this is good for Daniela, this is very, very bad for the receptionist. And essentially, this is not the receptionist's job, and she isn't in charge of doing this. And I think if you read good medical practice, you will become more familiar with these situations. So you're not supposed to dump your work on someone else who isn't even skilled in doing your work. And it just frankly isn't the receptionist's job to do this, which is why I think it's inappropriate, but not completely awful because the receptionist can still be of help. And of course, at the end of the day, Daniela will be tending to another patient. So it isn't awful, but it is pretty inappropriate. So next question, again, 30 seconds. So we have three completely different answers. Let's look at what the correct answer is. So that is a very appropriate thing to do. So the explanation says that the patient with the sprained ankle is not in any immediate danger. Whilst it might be a mild inconvenience, asking the patient politely to wait whilst the lost boy's mother is found is an entirely appropriate course of action. So like Yusuf said, we really looked at the need of the patient. So not just patients, but also lost boys in the emergency ward who needs us more. And in this case, the lost boy who is clearly very distressed, he needs us more. So if we just explain to the other patient that, hey, just another 5 minutes, let me just look for this boy's mother, that's entirely appropriate. You are allowed to do that.
Absolutely. So there are two components there. One in terms of urgency and two in terms of importance. Urgency because of the fact that the boy is crying and because of the fact that, of course, he needs to find out where his mother is and the sooner the out, the better it is. You can imagine just in terms of time, what works better to prioritize. If you focus on the patient, even if you're going to do really quickly over 10 minutes, that 10 minutes is going to make a huge difference to the boy, for example. Whereas, like Arisma said, it would be more of a minor inconvenience. And that leads me on to the second point in terms of importance with regards to that boy being lost and not being able to find his mother, compared to only being a minor setback and a slight delay for the patient with a sprained ankle.
So I think our last question is comfort the boy and assure him that his mother will be found. Another 30 seconds. A very appropriate thing to do, which is the correct answer. So the explanation says, the boy is clearly distressed and his mother is nowhere to be seen. It is therefore entirely appropriate that Daniela takes a moment to comfort him, especially given his young age. So absolutely correct. This is a very, very appropriate thing to do. And again, like we said, the previous answer was also very appropriate. So this just goes to show that judge each question in the same scenario independently. That is very important. Congratulations. So this was the hardest question. Distract the boy with toys and escort him to the play area. This is great. So we get a lot of good feedback where we can see what the hardest questions are. And again, like we said in abstract reasoning as well, take notes of everything that you do. So if this was the hardest question in today's session, what have you learned from this question? What is the NHS prioritizing? What values are they looking for? Take note of that and make sure you keep that in mind when you look at future questions, because in all probability, they could just twist this question around, talk about how there's a little girl who can't find her mother in the emergency ward. That could come up in your final exam as well. And you would have to apply the exact same values and skills that you learned in this question.
Absolutely. So make sure every mark dropped is a lesson learned.
Definitely. I think that should be your motto in terms of practicing for the UCAT. Yeah, so that's about it for today's session. We've covered all of our objectives. We're now just going to go into some feedback and then the audience Q&A. And again, in the audience Q&A, of course, you can ask us situational judgment questions, but really anything about your application, feel free to ask and we'll be happy to help. So we have someone with a 5, which is definitely an improvement from before the session. So this is all pretty good. We have a 4.3. I think we had a 2.5 before the session. So definitely it's gone up. And again, as we said, practice, 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 and take notes of your mistakes and learn a lesson from every mark dropped. And that will help you do better in the situational judgment section. And if you could rate today's session, great. Thank you so much. So just a little bit about our services. So number one, right after UCAT, you guys need to get into your personal statement. So we have personal statement review services. There's 3 different packages. So really whatever you need, how many sessions you need to review your personal statement, like pick and choose accordingly. Another thing that we do is a free consultation for 30 minutes, which you can just go over your entire application with a tutor from a really good medical school in the UK. And you go over your entire application. They give you advice. You can ask questions, all of that. So Yusuf is one of the tutors, so I think he can talk more about it now.
Absolutely. So it's a very popular service, our free consultation, in order to really get a diagnostic analysis of how you're doing at the moment. And I know that for many, they may be a bit nervous if they're unsure of what to be doing next, if they should be doing anything else. So it's really, our students really enjoy it. It's an opportunity to really find out if there's anything else that they should be doing and also how they can improve upon their current habits as well. So the purpose of it is to give you an overall overview of how you're doing, broken down into different dimensions, your extracurriculars, your academia, personal statement, and also going into interview knowledge as well to give you that head start so you can be ahead of the crowd.
So if you have any ideas for what sessions you'd like to see next, feel free to put that down. And if you can't think of anything right now, that's perfectly fine as well. I'm going to show you how you can send in feedback through our website. So if you just go to the Aspiring Medics, our services, online workshops. So just keep scrolling down. And you can send us feedback through Slido. So we already have 2 responses. So hot topics in medicine, NHS and COVID, and interview knowledge. So if you have any other ideas for future sessions, you can just leave it on our website. And if you have any questions, you can leave them here as well. So if none of you have any questions, feel free to leave. Thank you so much for joining today's session. We hope that this has been useful. This was the last one in our UCAT series. So best of luck for your UCAT exam. We're sure you guys will do amazing. Just follow the tips and keep practicing, and you guys will do really, really well in the exam. And if you have any questions from now until your UCAT exam, feel free to ask us on the group or privately, or even on the Slido that we have on our weekly workshops page. So thank you so much for joining, and goodbye.
See you guys next week, or in fact 2 weeks time, because we're taking a break. See you later.